today we have some special program for you today. We have something special for you, and today we'll be talking about our health. Today, that's what we'll be talking about. We'll be talking about our health. So, as we keep on hearing the religious aspect of this channel, today the time is up for us to also talk about our health. So we have in our midst a health professional over here to help us to take us through a condition that we've selected, which we all know that is worrying the world and also the youth especially. So we have a physiotherapist in our midst today who will be taking us through the condition stroke. He will be taking us through stroke, and we'll be learning about a lot of things about stroke. There are a lot of things about it that we all don't know about. So we have this specialist in our midst who will be taking us through the stroke condition and also giving us some tips for us to take home so that we will be very worried about our health. We will know how to live our lives as it is. So without much ado, we will introduce our guest today. My name is Mr. Reagan. My name is Mr. Reagan Yeboah. And today we have in our midst our physiotherapist, doctor. We have a physiotherapist. Yeah. So his name is Mr. Frank. Mr. Frank Kwame Peme. Yes. So without much ado, we would like our physiotherapist to say something little about himself for us.
So I'm a physiotherapist and I'm Frank Kwame Peme, physiotherapist at Konfanochi Teaching Hospital. And I've been working for the past 12 years as a therapist there. Yeah, so most of the cases I see are ranging from stroke to other neurological cases, and sometimes in some rare cases orthopedic cases, but my focus has been on stroke. That's why, and looking at how it's affecting the youth lately, I think I've had the urge to always go on such programs to talk about it, to create the awareness and what we can do to reduce the incidences.
Okay, thank you so much, Mr. Frank. So we all know what stroke is doing to our world now. We know what stroke is causing our youth now, and we want to know what is stroke. When we talk about stroke, what at all is stroke?
Okay, so stroke in the past in Ghana, people thought it was a spiritual disease where some ghost will slap someone in the morning and then half of their body gets paralyzed and they can't speak, because once they speak they will be able to tell which ghost slapped them and reveal everything. Yeah, so I remember as a kid, people, whenever someone suffers from stroke, they will say "Samai na abonasum." A ghost has slapped the person and that's why they are unable to speak and all that. But from studies we got to know that it wasn't so. Actually, stroke is a condition where part of your brain is not receiving blood or oxygen, and so that part of the brain will die, and when it dies, the function that it plays will not be able to play again. Nti yɛmfa say moja bi kɔ wadwen baby na bibi esi ne kwan se moja ne mba hɔ a, that part of your brain no ebewu.
Okay.
Na odwumadi di adwen na wɔ hɔ no, every part has a role that it plays. There are areas for hearing, areas for speaking, areas for understanding, area for feeling, area for walking and movement and all that. So depending on the area that will be affected, no, nipa no be show those symptoms. So there are two types of stroke. Based on this, we have what we call ischemic stroke and then hemorrhagic stroke. So when we talk of stroke, in simple term, bibi prevent se moja ebe ko nipa trimu a ene ma nya stroke. Iti kwan ya ebe fa so bibi si kwan se moja mba wa adwene baabi. One is when vessel na di moja na eba na pai. Announce say bibi esi ne kwan. Yemfa nse ofie na pipe ewo ho. E do time bi ubi a pipe mba, but the next house no pipe ba. The first thing you think ne say ana yen tube na pai. Announce say BBSC tube no munti na nsuo mba na. So it is the same way. So when blood is not flowing to any part of the brain, it's either there's a blockage or the vessel has ruptured, so blood is not going there. So this gives us the two types of stroke that we have, which we call the ischemic, which means something has blocked the vessel, or hemorrhagic. Okay. And in stroke cases, about 85% of them no ischemic. Omo BB a blocked vessel no. Hemorrhagic forms about 15%. And most of the hemorrhagic ones in the omo AB and the pressure was through. So the pressure goes like the patient has a hypertension, what we call in Moja. So there's always that tension in the blood vessel because so much pressure is pushing blood through it. Till do be a vessel no bit me apai it can rupture. Okay, and in that case we have what we call the hemorrhagic stroke. But in the ischemic stroke, the person may even not be hypertensive. It could just be a clot of blood in their system, and that blood could travel all the way into the brain, block a vessel, then and the person will develop stroke. Right. So that's the two types of stroke that we have. Right.
Okay. Na yebesan bisa biom se sesi a yehu the stroke ana yasen hu stroke nso mu nchiche. So we've known the types and also what stroke is. Now we also want to know what brings about stroke. And I say the stroke cry kwan na so a the brain.
Yeah, can you make this stroke bana answer and no ban mamindi can be a friend in clinical signs and symptoms of stroke. Because Yaribia na say say bibi sisi I am fan say oba ni tipa no na ho ayeshi. The first never about Jim say malaria. Right. Or fefe in this animal. So it means say your new may be a uhu a dead child say yari. Into stroke no, you say the main thing that affects your motor activity, nipa no movement. In classical form, no stroke no nipa na half of the body in a bedroom. Okay, yare be brave or hoe nipa be emre. My hunkrofo be brave on ma ni sisi wa tehwe we prana aka na spinal cord ontumi nante. See stroke, I know new stroke. But stroke is when half of your body is weak because there's what problem in the brain because of lack of blood supply to an area of the brain. Okay, a bit me affecting the panel motor activity. It also affects their speech. Some of them will not be able to speak, especially those that their right side is affected. Most of them cannot speak. Most of them cannot speak. So it can also affect the person's spatial perception. And they say, Onama, Oka Chenzi be a more full step, Pijan and Naya. Yama is a step here just 8 inches, Obi Pijan and 9 by 14 inches. Who the difference? As a Pijan and 9 Caribbean as a Pija into a problem with the space around him. Okay, Obi so on mobile Phyllis and a nymph 83 announced and the tech all those things near clinical signs and symptoms of shows it will be here a stroke. Now the obisam the risk factors. There will be so one the point right. I could let me to change or Numuria, which me as I could have we are one real that you bottom. Right. Unum okay, oh beer. And to go to me who be and I never be a daddy on body, no to me I say. Saturday will be to me my area. The risk factors now, you will more who do me. Your risk factors say I'm on a day. A non modifiable. Unto me, some. Unto me, here and found. Your risk factors are Yes, and on a modifiable. You can modifiable. It means a risk factor. Which may be found. And no, ya DB a warrior any this stroke bebruntino. Which may be found. Okay, non-modifiable. The only mean you're found. The main one is age. Age, they say stroke. You only stroke here common in the elderly than the younger people. We don't expect stroke in 17-year, 18-year-old person unless say or risk factor be a who bit me man stroke. Okay. Inti you only say stroke here common in people 60 and above. Even though they say youth need your gym. Right? They say we are having and you be suffer no. Inti they say youth need so the gym. No musunya. First cry near stroke here esca 4 year. But you see I hear for so the gym. And then we have race. Race necessary you be near now you brony. Now stroke a common will be before we change abrofo. Your Arabia a common way abrofum. I be new any another.
Na no the entire bibisa bana.
Your friend be genetic disposition. You be near or genes no. Any your exposure to certain harsh conditions or environment and all these things no. A man who develop some of the risk a bit me a stroke. Okay. Men can the same way. You find in Crawford North Korea for. Omola Kijina, a my motu mubon. And it's an Crawford Nedins or motu mbebon. Right? By yen was a gene. Into yen motu ye jumani 1850 bit me a bon. Okay. Your new may be because o gene being intino. O start to say o ye bibia ebe mo etumi ayede ben enya because of your race. Okay. And then the last one I make as I found here hereditary. Hereditary ni say untumi nsesa se me maame ni. O maame adwa fo a ono maame. Untumi nkofo bi maame nya o maame da. Ni moja no dia ayede ben awo. Inti say stroke ewo wabusu ma chances say obi a one ne share moja bia benya bi ni very high. It means that genes na ne woni penimo na ama wanya hypertension na ne di stroke beban. We pass it on to whoever is next. Okay. Inti hereditary inti sa no ma we there. Untumi nsesa age. So okay in football age cry age na so oh yeah 20 years now waka so the 10 you are still 20 in your body. Race okopo ho say den cry other so you bibini. Hereditary say adwafo wa na wo a untumi nsesa ne say equiata na wo me. Right? So those things you can't do anything about them. But modifiable risk factors near the obetumi be found. And the first one I'll talk about is hypertension, which is one of the causes of stroke. Or pressure or sura. Or pressure or sura or pressure drew. One of the challenges that we have in our youth now is that when we saw a hypertensive no on nindro. Some of them think a pressure drew no last 3 weeks an opportunity to na woman be friend say or call hospital the previous day no. Almost man a pressure drew beam. Now cast or no we in one way. Now I'm say pressure is not like malaria or no drew. Now to us you take the medication till the day you die.
Okay.
Also no nim sent no drink say doctor ni bu ntindo no kra wanje. Now I'm say no. It means that this now one no do no pressure between akosro. Emma between me and stroke. So I had to tell her to go back to the hospital for a medication. Over pressure, you do two no so be control pressure. Now mema no titu o me stubborn mum pain no because some of them no honma or no ma untumi fire yi. Say me kasa out here say untumi mbo adwuma. They can't perform in bed. So because of that, they feel why should I take a medicine that will not help me to perform in bed? Okay. So they'll stop taking it. Right. And that could lead them to getting stroke. That's one of the major causes. And there are lots of people walking around who don't even know they have hypertension because they don't go for any checkup. Right. Yeah. The other thing that we also talk about is diabetes. Diabetes mellitus in omega is also one of the causes of stroke. Diabetes would it can affect so many things in your body. It can affect your heart, it can affect your blood vessels, make them hard. If they harden, your free be atherosclerosis, it means that the amount of blood that is supposed to move smoothly in it will be reduced, or their rate of movement in the blood vessel can reduce. And blood into mean flow here, they can get stuck together and then form clots. Moja gu has its here in China abotwa. So those clots one day could dislodge and go into the brain and cause stroke, right? And diabetes can also be one of the things hypertension. I don't know, the thing about them is like if you have diabetes, there's chance that you could develop hypertension.
How is that linked?
They are linked because from what I even just said about it causing your blood vessels not to shrink, it means that your heart will have to pump harder to push blood through it.
Okay.
So that could lead to hypertension, right?
Yeah.
And then we have heart diseases like atrial fibrillation. Those people, their heart rhythm is different from the normal one. It's not beating as it should. Omo ayesi omo atrial fibrillation no. Omo na koma ni ntumi mboye. Said the ese ebo no. In simple terms, said the mema obeti ase no. Enu no be hu a se wakoma mboye a. I just wakoye test bi. Ye frɛ no ECG. Enyo momdum kanea no. Ye de bi betare obo. Na draw lines bi. Eno na be chrom say o nipa na koma na nye de be. En contract ye obi kra ho no ma. Enka koma na ese emoa pompi moja biye ewo mu pie. Ba ono ne de na emoa moja ne bikam. Esansan na chi begum. Okay. Nti begum na etai ho na etumi bo ntoa. Nti omu ana ba kwa shutu na akona adwum no anya stroke. Omu ana ba kwa shutu na akona adwum nti obi o atrial fibrillation bia no omde ne tu aduru ema ne moja na ne so. Ebi o cry is just aspirin 75 milligrams no meka chose de bia afa. Enye bibia ebe cause problem severe bia ma, but still microphobia or more beka so on. The other thing is heavy alcohol consumption, which can also affect nipa na koma said the ebo, your heart rate and all that. Nti ye unsa alcohol mo no nsa bebre no so they are also at risk of developing stroke. And then we have hyperlipidemia, omo a srade dos mo mojem. Now get the difference. You will be on mo yobolo kese pa, but srade oni mojem no e controlled. Your srade a enam mojem ni your srade wo skin. Adipose one, the whole skin your friend adipose fat. Eno na ma ye kese obolo. But the wo mojem no ubetumi aye slim. But na nnuane a odi na nye nti no sa srade no wo mojem.
Nti betumi anya obi o ye slim so.
O ye slim ba kwa check no na yeah, there's a lot of cholesterol on mojem.
Okay.
Nti such people no ebi ono kra onya symptoms bia until say ebe do advanced stage a ebe say na ansa na sanu manaba. Then we have oral contraceptive use. In remuso a say a man enom sa emergency pills ni bebre no, they are at risk of developing stroke. Hormonal cause hormonal changes we can make them their blood clots faster than the other person. Postino2, Lydia and the rest nka be tie Gani be last time no as someone can say you are supposed to take in a maximum 3 in a year.
Okay.
But guess they say more to separate.
I say the ekosopa.
More to separate. Intino. And remark as that those who abuse it at higher risk of developing stroke. And then smoking too is also a risk factor because smoking causes a similar thing like the way our vessels near hardened, no. It can also cause a similar thing. So these ones, you know, say, and you may have a boss in no.
Yeah.
A idea will be to me a jai, will be to me be found. So those are the risk factors, no.
Okay. Okay. Thank you so much, Mr. Frank. So when we talk about also the signs and symptoms, then the bema who say unipa we or stroke.
And na me kind no say obeyemre nefa ebeyemre ne kasa betumi asesa. One ne kasa ubisa na asemu aso atomum. Obeka cho say na nimfa ayi dududu. Obeka cho say ne nan bi opeso peja ne nan a untumi. Obi nso be lose the balance. So if you ask them to walk, they will fall. So all those things, and most of the time, you know, the donor will complain of severe headache in half of their head. obeka chose ni tifa ni yapa. And sometimes we don't pay attention to these things. The severe headache could be hypertension or something that's going on in the brain. But yeah, penny akonom para. Para will not cure the hypertension. It will only cure the pain. Inti akoit say pra, but one bibia won't pra no. Eventually will be pra. Ema cause damage. A drone sound already more. Right.
Okay. Na eba enema we na edem pa na yetimi eye fa ho. Se enema bi se eba yetimi ye bibi fa ho ana.
Yes. So stroke is here. The very first thing. Unya hu se nipa ni nya science na. Mo wo de check pressure na mo check na pressure no was right. It could be a stroke neighbor. Mo de mu ni no kra the first thing na nipa na ka cho say o feel say ne fa yemre. And an kasa owns and kasa s anyway. Just take the person to hospital.
Okay.
That's the first line of it. So I'm going to scan no say stroke. They will start the medical management. Medical management is medications from the manner be control at the corner of the stroke nearby. No, in the infant say high blood pressure. Be man in do be pressure na above him. Say clot no more. Be man in do be man mo jai de be anane. Right, into your man in drive control at the corner of this stroke nearby. Say cholesterol, then better cholesterol do so. Then the other aspect now, see a year known to me anyway, no. That's where the physiotherapist will come in. And it's exercise that will correct those things. But the exercise never bow. Into the therapist may come in to help prevent another stroke. Ubi or stroke, ubi to me another one. Me patient being rare when you stroke 3 times. In the left and right.
Then this maneba.
Young fans or clots in no stroke. It should to call the brain no stroke. Chances are there could be other clots there.
Okay.
A year not tie happen or almost as a clots in the block here, no. But almost a year hypertension and vessel ne pie, you know. A year and tying say over saying another one unless say on that pressure drew be also.
Okay.
What I was talking about the care, no? So we want to prevent another stroke, say sense through education, and then you want to prevent complication. Complication is a so one she nipa ni year, nensa ni betumi atwentwom. Ne nan betumi atwentwom, obeka mpem ni we. Obe say no ho ontumi control ne Johnson ne sa ne maneti no. Therapists they bemu to help this. And a caregiver said the mobile will feel no. It's the duty of the therapist to take care of that and teach you what to go. The nurses too will teach you about nindro any time or unfairness and man. Oko hospital, so bisa doctor no. Say do it time ben on so did answer na one say esa anything. You have to ask all those questions so that they will teach you to know what each drug does. Okay. Until with the physiotherapy, no, the whole thing is getting the person back to work. No crying say, especially in Chrome had say stroke you be didn't be chinchia, didn't do rasrana. There's no drug for stroke.
Okay.
Tissue ne worry. Until you need a drug, say do no more. The person will have to learn how to walk, how to use the hand, and all those things again. But okwa ibeka cho say fadi we rasrana. Enye nebe ma hondia be. Movement is a skill. You know how to walk. You said ye tear the anekoyano. You said ye see atade. It is a bibia you're now to me in ye you have to learn it again. And yet drubi na obenumka bibisa or manka or wakola or do HB and the man non one who said the benanti or who said the basin in your. But those things are skills. And for every skill, there's no medicine that you take and then you know the skill.
Okay.
It may just help you to do it better. But there's no medicine say me no more. Ebema metumi ayede energy drink crowd no more. No one juma na untumi. You have to still work with it. Yeah. Right. The physio is to help people gain function again. Baby on mom didn't be kwa kuchi on be banana complications e mazo na ayede ben. Asay no. Aba. And in that case you're not getting the results. And then one thing I also want to say is that sometimes almost stroke a drone decide with that dankrofo. The truth is that especially in younger people when you stroke na obia ama na duro bia for sa treatment na America no enye pressure duro ni we na America make say fasra ho ni we ana wanye physio bia kra ba efie mo boa na ma ne sorry ejina ni we a the person can walk again. Inti nya
for young ones,
for younger people no.
Okay.
And obi are not yet active that unless a very massive stroke.
Okay.
But in most of them, in younger people, ujana keke kro be recover. But the therapist comes in to make sure the nipa na recover ye. Because obi aka so mpeja nsa, if you are the befa baby say ansa no apeja. But the therapist will teach the person say no ye peja nsa say. No achen how to do it right. Into one hwe ya, onipa no be ka cho so we kro kọ ho no. Ye dia de we sasa no na ho ato no. Meanwhile, it's not that thing. Because abrofo na enya stroke no ho to mo abrochi ye mfa bibia ansram.
Okay.
It tells you say nya de na ye de sra wa ha na ma ho ato. Senka ye sa na nke ma ho to wanka abrofo no nka onne nko ho to mo da. They go through the same physiotherapy, they go through the exercises and then they get well. And that's what we need to know, because a lot of people go and take concoctions and all that, and at the end of the day they will even damage their kidneys and other conditions of the Beba hospital. So the therapist just comes in to make sure say obe prevent this okay. And the next thing I make as interventions no e bi no ho no ma controversial practices kokoye herbal concoctions me konoma haban bi be ma me watom. It's never true. Healing comes. We are Christians, we have Muslims, we have other. You can pray, but me who obi a wabompa say bucket na esi on no answering besi niti so na besi niti so. You have to do some work to gain strength, right? Until healing comes near, but make sure you do your therapy. Okay. Then we have the quack therapists and the doctors around. Omeka chose brayo massage chairs. Your sa massage cream anyway. All the stroke number.
Omoye quack for no moye.
Dodo na ye quack homeopathy bibri aba. Most of them are quack.
Okay.
Most of them are quack. Okay, they tell you they build the stroke nebeko, you will say massage. The massages are just to prevent muscle from becoming tight and to improve circulation.
Okay.
But massage does not bring strength. You have to exercise the muscle to get it stronger. Right? Inti enone ni nyoma massage chair uko demo na chuchuwa. Those things won't make your patient come back to function. I just oye bibi ebe man ho ayeden. Right. Okay.
Na sa exercises we mu na no ewo on say oka bibi say stroke no adwen mu ana efi say bia adwen no bibi a pompe blood ko ho etimi pai ana say etimi block na exercises we na ewo nsunsanso bi ewo adwen no so ana a etimi manipa no essence ni that dem
say obinya stroke say dem kind no adwen no ba bia ekotoy no sa that part na juma na edi no you won't be able to perform it.
Okay.
So your brain has the ability to learn. In yen field they friend in neuroplasticity. It means that the person can relearn the activity na no. So you help other parts of the brain na a home way to learn the activity again.
Okay.
And so we take the person through exercise repetitive. Abia maunsa so to adewe so ontumi nye ne aboa no ne a chance de you repeat it 10 times. Ebedu be bonus on no atumi ye. Ebia oyo nye ni ye no aka chance okay. Is how to me epeja to so there, but let's do it this way because this way looks better.
Yeah.
Right? So your brain is able to relearn and help you. And it's easy relearning in younger people compared to the very aged, like year 70 and above. No? That's why I said the younger people recover faster compared to the elderly. No?
So what makes it so easy for the younger people?
Your brain is still active.
Okay.
And then you have enough organ reserve, you have enough strength to go through your therapy compared to the aged. They be a crowd checking now already in dementia setting in. And to catch and some mounts as a crown until they can say after stroke. But younger people there. And there's also the motivation for a young person that I want to work, I want to go back to work.
Yeah.
I'm losing my livelihood and all that. But to be already 80, on Rajuma Ben or Kwakwe, Dodona ITF. So they feel like mean to me cry and sound be my because my baby. But someone who is 35, 36, or ma and all that, they feel the urge to want to do, and they all come from the brain. It's the motivation to want to get well. Right.
So say without motivation, not just say onipa no a bedin say bia won say stroke na basa no buwa meninkofo bibra onya stroke na odwen so oba bewu
na be mo.
Nti say nipa sa no ono no etwa say abusua no omo wo bibi e wo so omo yedi sa adwen ni fi ni trimana say
and na make us say ba physio no cry. We also educate the caregivers about what they need to say around them and what they are not supposed to say around them.
Okay.
And that's all can you maybe a bit discourage them, right? Just 3 days ago, I went to see a certain patient who mentioned Abdulwadi, but I'm sorry. And then the banner atiati and the same koi. Was the me banner atiati na deben. I tried to talk her out. Kasade, could you believe we were able to walk with a frame? Yeah, Nantine Ban say, hey, Sama me to me the idea Nantina on that. And I explained to her, say, if you on my wood dinner tell me we are very rebellious, and I mean ye beam. When you so or Phyllis or no won't to me be sharing your own. Right. So sometimes the things we see around the patients can influence their recovery. If the person is not motivated to work, if you are and none of my colleague back or catchings and the patient be okwa or more be boa normal bonabumu and edge no atare dan one san original. Yes, I'll catch and so original. Was it be of over 30 minutes near panicho? So such a patient on year ready sobenante. But there are some of them and them inquire, they'll call me. Kwame, Naumba. Yeah, we are prepared. It means that they are motivated to do something, and we get positive results from such people more than those they are not motivated. So motivation plays a very major role in their recovery too, aside the kind of therapy they are doing.
Okay. Thank you so much, Doc.
Welcome.
Say yaka nema bibri na meje de say na tifo ene ahwefo ebenya nema bibri afi de na yesuan mu. Okay, thank you so much, our viewers. Doc, your last words, and also can put your number on the show for us so that
what I would say, stroke is really becoming common lately, especially younger people. No, in stroke pa, men kasimisa intimenjen. O check your pressure, ne cholesterol, this animal, and cost still more than 100 cedi simple. No must test be no cry no beyond my pressure cry within 1 minute no any results. Sugar within 1 minute no any results. Sugar cry machine 30 seconds no any results. This can save you a lifelong issue of not being able to use part of your body. Then the and make kind risk factors no sa and chin be and then those who are abusing the contraceptive, oral contraceptive. If you can avoid these things, you can prevent yourself. And if wabusu ni be your stroke there's a chance the risk no mabusu. So you need to at least every year be a check say uni risk ni be. Okay. But menfa we nso also say stroke yan fan sign. So who kune me na se menya stroke I mean to me fan sign. But so unua na me na menya it means wonso betumi enya but mean to me fan sign.
Okay, so Doc, please you can put your number.
Okay. My number is 0240-152-934. 0240-152-934. Oh, friend, I'm the Kwame Mio Confanochi Physio. When you have any needs, we are always ready to answer you and help you. That's it.
Okay. Thank you so much, viewers, for staying with us to this far. Edamasi bebre ahwefo ese money atena babedu sempempenswe na yese mo se mo be subscribe sa show wi ama yen fi se wo enema bebre a yene mo ebeche ewo modada setena mu ɛne mo apɔmuden mu. Nti yɛbɛsɛ mo sɛ mbɛ subscribe ɛde ama yɛn sɛdeɛ ɛbɛyɛ a yɛbɛtumi ɛne mo akyɛ sɛ nneɛma wei. Yɛda mo ase bebree. Thank you so much for watching us. Bye bye.